no one's ever going to forget a major traumatic event that they lived through. And many would argue that their life will be forever changed, but that doesn't mean it should hijack your life.
Hello and welcome to Wellbeing. I'm Jack Hodgins. Following on from our first episode in our series on PTSD, we are now speaking with international expert and leader in the field, Dr Shaili Jain MD. Dr. Jain is from Stanford University, California, and is a physician, PTSD specialist, and trauma scientist. She is a leader in communicating to the world on matters to do with PTSD, and has done so on CNN, the New York Times, the BBC, and now Wellbeing. Hello, Shaili, and welcome to Wellbeing.
Hi, thanks so much for having me.
Many have heard the term PTSD, but what actually is it?
Post-traumatic stress disorder is a constellation of symptoms that have been described since ancient times, but it remains this kind of elusive psychological condition. It's famous for causing nightmares, flashbacks, and exaggerated startle reaction. Lesser known but equally devastating is how avoidance and mood symptoms can render a person's emotional life totally barren. PTSD mutes happiness and yields instead to an irritability that keeps sufferers alienated from their loved ones and from the world around them. So PTSD really cuts to the heart of the life of a trauma survivor and just really interferes with their capacity to love, create, and work.
Are there any different types of PTSD?
So PTSD can result after many traumas. If you think of things like rape, family violence, being robbed at gunpoint, escaping a major fire or car accident, being a refugee who is forced to flee. They're just some of the examples. Obviously soldiers back from combat zones, we find higher rates of PTSD in military personnel, but you also find higher rates of PTSD in police officers, firefighters, low-income women and teenagers who live in high-crime inner-city areas.
Can it change the brain over time?
So we do have early evidence to show what changes happen in the brain of someone who's living with PTSD. I always tell people the minute I start talking about what the brain manifestations of PTSD, I'm sure the science is evolving, and we're yet still in our infancy of knowing how the brain is impacted with PTSD. But we do know that there are some changes in an area of the brain called amygdala, which is a part of the brain that responds to fight or flight. It's that part of the brain that is plays a key role in the processing of fear and pleasure. We know that's overactive in people who have PTSD, so that explains why they can be so reactive in their behavior. We also know the hippocampus, which is a part of the brain which is crucial to memory formation, that is smaller in people who have PTSD. And then also the frontal lobe, that region of the brain that's involved in the planning and the execution of human actions, that's less active in people who have PTSD. So, if you think about it, you have this overactive amygdala, which makes someone more reactive, and then the frontal lobe, that part of the brain that kind of slows you down a little bit, it makes you slow your roll, that's less active. And then the distortion in memory too. Those are some of the areas that are implicated in the neurobiology of PTSD.
Is there a genetic predisposition with PTSD?
So it appears that up to a third of what determines whether or not someone will develop PTSD after trauma, because an important point is this, oftentimes trauma exposure and PTSD, oftentimes they get conflated. Just because you're exposed to a traumatic event does not mean you automatically develop PTSD. But it turns out that about a third of the risk associated with developing PTSD is probably associated with genetic factors, like literally how your brain is wired, literally how your body responds to trauma. And a lot of that is determined by genetics. So, there appears to be a heritable component. Even though there's a very clear etiological agent, the actual trauma, but there seems to be a heritability in who develops it and who does not.
Is it possible in any way if, say, the parents have PTSD for the child to be born with PTSD?
So not so much that children are born with PTSD, but there is a lot of early evidence to suggest a kind of generational component to how trauma is transmitted through generations. So, for example, there are some studies that have been done in the epigenetics of PTSD that look at how psychological trauma impacts, a woman's eggs or a man's sperm, and then how the changes in the sperm and the eggs are then transmitted to future offspring, even though those future offspring themselves may never have been exposed to trauma. But in the event sometime in their life they are exposed to trauma, then they are going to respond with this altered neurobiology. So when you think about mass traumatization, when you think of Holocaust, when you think of genocide, you can start to get a sense of the deep footprint that PTSD could potentially leave via this mechanism of epigenetics.
How can PTSD change someone's behaviour?
So a lot of it is to do with the psychological symptoms that can manifest after trauma. People who have PTSD-related nightmares literally have nightmares where they're reliving the traumatic event. And these nightmares can occur 5, 7 times a week. And so you can start to get a sense of the toll that it will take on the quality of somebody's sleep. And we now know from sleep science that sleep is essential. It's an essential driver of good mental health. If your sleep is getting destroyed via nightmares, you're going to be depressed, you're going to be more irritable, you're not going to have as much good focus. And you can see how that can play out in your interpersonal relationships. You can see how that can play out in your work productivity. So that's one example of the symptoms of PTSD and how it impacts behavior. But another example I could give you is how the mood states of PTSD. So people with PTSD often live with anger, shame, guilt. They're perpetually caught up in these mood states related to the trauma. You can easily see how anger, being more prone to irritability, or maybe road rage, or maybe being impatient or snappy with your children or your spouse. You can see how that can contribute to disrupting your day-to-day life and the quality of your interpersonal relationships.
Is there any way that someone with PTSD can manage it?
It used to be, when I was first starting out as a doctor, it used to be that PTSD was thought of as being untreatable, thought of as being disabling, a permanently disabling condition. But the good news is today that is not true at all. PTSD is very manageable. It's very treatable. We have many, many talk therapies. We have many, many medications that can help with all those symptoms that I just described. And certainly, the trauma is never going to go away. No one's ever going to forget a major traumatic event that they lived through. And many would argue that their life will be forever changed, but that doesn't mean the trauma has to be in the front seat of your life. That doesn't mean it should hijack your life. Symptoms are very treatable. They're very manageable, and that's really because of 2 decades of scientists and researchers advancing the science of PTSD. There's a lot of hope. No one has to live and suffer with PTSD their whole life.
Can someone fully recover?
Certainly, I'm sure there are many people who are leading very healed lives after having sought treatment. To a certain degree, there's like a spontaneous remission as well that can happen. I think what's key is early intervention is key. The quicker you get help, the better. We know that the longer people leave it, the more entrenched the symptoms become, the more complicated they become. Early intervention, early treatment is key, and that's where education matters, right? You need to know what it is you're going through before you can get help and treatment in a timely fashion. The same way if you are having a heart attack, someone's got to call 911, or if you're having a stroke, the same way if you get diagnosed with breast cancer, you've got to get help quickly. We've got to start thinking the same way about psychological conditions. The longer we leave it, the more entrenched the symptoms become.
So in a lot of ways, despite someone having PTSD, they can live full and happy lives.
I've definitely seen it in my practice. I've been doing this for 20 years now. I've definitely seen it. I've definitely seen people's trajectories get better and better over time, and for them to be able to perform in the workplace, be the type of parent they want to be the type of spouse they want to be. I've definitely seen people recover just the same way, just because you struggle with an addiction doesn't mean you're going to be an addict your whole life. You can live a life in recovery. It probably means that you have to change your life in many ways, right? You probably have to adapt in many ways. You probably have to learn so many coping skills and strategies to deal with flare-ups or to deal with setbacks. But it is possible. I see it all the time in my clinical practice.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Shaili Jain from Stanford University, California. If you like this content, check out the rest of our series on PTSD or many of the other great episodes we have on the list. Does PTSD know any age, or can people even in their elderly life develop it?
Yeah, absolutely. It doesn't know any age, it doesn't know any gender, it doesn't know any ethnicity. Children can develop PTSD, the elderly can develop PTSD. In fact, becoming more and more documented in elderly populations. It might have been tricky in the past because often PTSD is hidden by older folks because, they might not name a trauma as a trauma. They might not have the language to call it that. Or oftentimes PTSD has been hidden in elderly people. But then when they go through the stresses of aging, like retirement or the loss of a spouse or decline in health, then the PTSD comes right to the forefront, and it becomes very, very obvious. These are people who might have hidden it by, under an alcohol addiction, or they might have been workaholics their whole life, or they might have been very reserved, cut-off personalities. But then when they hit the stresses of old age, oftentimes the PTSD can become unleashed. We know that PTSD sufferers, as they age, they're more likely to perform poorly on memory, processing, and learning tests. So there's some data to suggest a correlation between having PTSD and then developing dementia in later life. Certainly, older adults, as they become dependent on others for their day-to-day living, they're much more vulnerable to trauma as well. So things like elder abuse, the same way there's child abuse, there's also elder abuse. So we've got to keep an eye out on our older populations because they are in some ways more vulnerable to being exposed to trauma.
Does it affect people across the ages in different ways, say to a child to someone who's, say, 70? Is there any slight differences between the PTSD conditions?
Yeah, definitely. I think in children it's most obvious because, the same way in adult brains, if you look at children with PTSD, they also have altered neurobiology, but that plays out in the way they learn in school, the way they play. Child psychiatrists will tell you that there are really important differences in what PTSD looks like in children. So, for example, children who are really young, like pre-K kids, they might not understand death as being something irreversible. So their response to their life being threatened would be different to, say, a teenager's response. A mature teenager is pretty much like an adult. So a lot of it is at the stage of the development of the brain and the child's capacity to understand and interpret the trauma. So, yeah, definitely in kids it plays out very differently, and it's very much linked to the developmental stage that a child is at.
How should we frame PTSD? Is it a brain disorder, or is that not really the right terminology?
It's a psychological condition. It's a well-documented psychological condition. There's a wealth of evidence to support it as a diagnostic construct. So that's the way I view it, as a psychological condition, as a mental health condition. But obviously it has neurobiological underpinnings. As we had discussed, it's associated with neurochemical changes in the body. It's not really, I don't like to see it as a mind-body divide. It's all kind of interrelated. But generally, yeah, I would call it a psychological condition.
What is the process that people go through into getting diagnosed?
Well, so the first step is to understand that something happened. So if you go through a major trauma, and like I said, there are many things that constitute trauma. Typically, when we talk about PTSD, we're talking about traumas that represent a threat to your life or a threat to your physical integrity. So if you go through a major trauma, on one hand, you should be reassured. Humans are wired to be resilient. The vast majority of humans will heal naturally with the course of time. So all you've got to do is give yourself some time to heal. So in the immediate aftermath of a trauma, in the first couple of weeks, you might feel a little jumpy, you might feel on edge, you might be troubled by reminders of the trauma. But the reality is over time, all these symptoms should dissipate, and within a few weeks, you should be back to normal. If that does not happen, though, if you're still troubled by the events of the trauma, if you're not sleeping good, if you're startling easily, if you're really on edge, if you're turning to unhealthy ways of coping, like drinking too much alcohol or turning to drugs, that's an indicator that you're not going to heal naturally. And the first step would be to seek the help of a mental health professional or tell somebody, communicate it to somebody that maybe you're not okay. And it's okay to not be okay. Exposure to trauma is really, really common. In the United States, 60% of men and 50% of women will survive a major trauma with a big T, in their lifetime. So the odds are this is going to happen to to all of us at some point, or if not us, someone we know, someone we love will survive a major trauma if you look at those odds. So even though only a minority of people will go on to develop PTSD, because the rates of trauma exposure are so high to begin with, even those small percentage of people who develop PTSD, that actually turns out to really big numbers of people. So, be aware that trauma happens to people. Some people will be fine with the passage of time. Some people won't.
In saying that it's so prevalent, is there any stigma that surrounds PTSD?
Yeah, definitely there is, as there is with a lot of mental health conditions. I think the crux of the problem is because it's an invisible wound, because it's not really obvious to the untrained eye that you are suffering. Whenever we have that situation, there is always a lot of stigma, because I just think human beings, by nature, we just like to believe in what we can see. So I think there's always stigma surrounding mental illness for that reason, because people can't actually see it, because you're not walking around with a bandaged leg or some obvious injury. People don't believe it, right? So there is some stigma in mental health issues. I like to say, over the last 20 years of my career, I do think the stigma has been broken down a lot. I think it is now much more acceptable to express when you're in psychological distress, and people are much more compassionate, if you're suffering from psychological issues. But yeah, there's a lot of stigma, and I think a lot of that has to do with how you were raised and how the people around you might respond. So if you come from a family or a community that has a lot of stigma or maybe a limited understanding of psychological wellness and mental wellness, maybe you'll carry that with you. If you come from a background where you might not trust people in positions of authority, and this is very common in people with PTSD, because oftentimes when there's a human-made trauma, a lot of trauma survivors, they don't trust people in authority as a result. And definitely whenever you go see a doctor or whenever you enter a healthcare system, there's a vulnerability associated with that. You really have to put your faith in the system, and you really have to expose yourself. And sometimes people don't like that. The thought of that is not good for them, and that might be a barrier to them seeking help.
What are some things that we can do to improve upon that stigma?
Well, certainly from my profession, I feel like in the last 20 years, we've done a lot to make PTSD more accessible, more acceptable to the people we're trying to reach. So a big push, for example, is getting rid of this false dichotomy between mind and body, right? We tend to think of, when you go see your doctor, you go for a physical checkup, they check your blood pressure, they check your glucose, if you get a pap smear, you get a breast exam done. But the mental health is integral to physical wellness. They're all intertwined. There is this notion that there's a separation between mental health and physical health is a misnomer. It's a false dichotomy. So I think the first thing we can do is integrate the two. So, a lot of what we're doing here in the United States is actually integrating primary care and mental health. So, when you go to see your regular doctor for a checkup, they'll screen you for mental health issues too. They'll screen you for depression, PTSD, anxiety disorders, alcohol abuse. And if you screen positive, guess what? You can go talk to my colleague next door who's a mental health professional. That really helps lower the stigma, I think. Because, if you're talking to another doctor who's in the same office as your regular family doctor, maybe it doesn't seem as scary to you. So that's a huge one, a push to actually change the settings in which we deliver care. Another example would be the development of apps. The Veterans Affairs Administration in the United States has developed an app called the PTSD Coach, and anybody, regardless of whether it's civilian or veteran, anybody can download it if you have a smartphone. And inherent in that app are loads of really cool tips and strategies and ways to educate yourself about the symptoms of PTSD. And the content has been designed and put forward by really thoughtful, credentialed individuals. So, the quality of the content and the information you're getting is vetted and it's good. And sometimes psychoeducation is huge, just getting the education to people about what's going on and why their brain and their body is reacting the way that it is. That in itself can do a lot to alleviate people's, concerns. So, meeting people with their ass, having a tool on your smartphone, something is better than nothing. Things like that, that's what we can do. And for anybody out there, like I said, if you look at the rates of PTSD, the odds are someone. There is somebody in your life who you know and who you love who has PTSD. That's what the stats suggest. I think everybody can do their bit by being open to that thoughts. And if you are confronted with somebody who survived a trauma, being there for them, listening without judgment, letting them tell their story. These are really little things anybody can do to make it easier for someone with PTSD to get the help they need.
You're listening to Wellbeing, a nationally distributed radio show and podcast. My guest today is Dr. Shaili Jain from Stanford University, California. If you like this content, check out the rest of our series on PTSD or many of the other great episodes we have on the list. What are some of the ways that we can kind of help some of those people that may be suffering from PTSD but have that kind of old mindset towards mental health?
Yeah, I mean, that's a tough one, right? Because we certainly don't want to coerce people or force them to talk when they don't want to. That's certainly not what we do. A lot of times, the reason people end up coming to see someone like me is because a loved one has kind of said, enough is enough. They're on the brink of divorce, or their kids won't talk to them. Sometimes they've lost a job, or they're facing some disciplinary action at work. So a lot of times they kind of hit a version of rock bottom, which is unfortunate. But sometimes that is kind of what is needed for people to realize they need help. I think we always want to support people in our life who are struggling with mental illness, but at the same time we have to be able to draw a healthy boundary and realize when we might not be able to help them anymore and when they're in need of formal professional help. And sometimes that's what gets people in through the door. It's tricky, like I say, I think that's why I enjoy talking to people like yourself, because I think talking about this in a public forum, somebody could be listening to the podcast, that might be an aha moment for them. Talking about it in a way that people can understand, those are types of ways we can, like I say, elevate the public health literacy about it. It shouldn't be this big, scary thing, We know enough about the science of PTSD that we should be pretty clear about how to deal with it and how to talk about it. It doesn't have to be shrouded in stigma and silence. And, I should point out, a lot of the stigma to do with PTSD has got to do with some of the traumas that are associated with it. So, if we can talk for a minute about, for example, rape, right? Mm-hmm. Yep. Rape is the trauma most likely to lead to PTSD, right? More so than combat exposure. And in the United States, and again, I have no reason to believe the stats are that much different in Australia. In the United States, we know that nearly 1 in 5 women has been raped at some time in her life. The problem is rape carries the stigma, right? Historically, the rape survivor is the one who risks being shamed. And that in itself forces them into silence. The problem is it's the silence that bolsters rape's power to wreak havoc in the life of a survivor, right? Oftentimes when survivors do speak up, they face secondary injuries, they're subtly or not so subtly blamed. So whatever we can do as a society to give post-trauma social support, that's really powerful in helping survivors heal, especially for women. When they're denied that support, the consequences can be devastating. So, if you look at societal movements, like if you look at the Me Too movement that happened, just a few years ago, that definitely translates to less stigma surrounding rape, less secondary injuries for survivors who speak up, and more social support for survivors in general. And that can only mean benefit in terms of reduced PTSD rates in the future, right? Just by supporting trauma survivors, you reduce their odds of getting PTSD.
Do people with PTSD usually need to be hospitalized for it? How common is it to be hospitalized?
It varies depending on the severity of the condition. PTSD rarely lives alone. It is often accompanied by depression, by addiction. Anybody who lives with PTSD lives with a higher risk of suicide. So you can imagine that if you're on the more severe end of the spectrum, so for example, let's say if you're someone with PTSD who's also addicted to alcohol, right? You can imagine how those two together could expose you to risky situations, You might end up harming yourself. You might end up impulsively harming somebody else, and then that you can see how that could lead to a hospitalization. But that brings me back to my earlier point. I think the key is early intervention. The quicker you nip the symptoms in the bud, the quicker you get treatment, the better the prognosis. It does not need to be this serious disabling condition.
What are some of the ways that family members can help?
If you know your loved one has survived a trauma, get educated. There's so many websites out there. If you can direct people to my own website, we have a resources page on my website that has vetted links to professional organizations that give really high quality, trusted information about what PTSD is, what trauma exposure is, what it looks like. So the first thing you do is you get educated about what trauma exposure can lead to in terms of psychological symptoms. Secondly, make it known to your loved one, communicate to them in the best way possible, depending on the nature of your relationship, depending on the type of communication you have, that you're there for them, that if they want to talk, you're there. And then if they're ready to talk, make sure you listen. It never ceases to amaze me how quick human beings are to shut someone down who's trying to share a story, and when it's a difficult story. I think as human beings, we're very happy to listen to funny stories and light-hearted stories and heartwarming stories, but anything that is difficult, that is traumatic, that is, what I call unspeakable, humans are hardwired to deny the unspeakable, right? Think about it from an evolutionary standpoint. If we really absorbed how terrible the world is and how much awful things happen on a daily basis to millions of people, it'd be really hard to live, right? It'd be very hard to live. We'd all be pretty depressed. Just recognize that inherent to us as humans, so sometimes when a survivor presents to us and they wish to speak, we as human beings can be unwilling or unable to bear witness to their story. And so inadvertently, we force the survivor into silence. The problem is PTSD thrives under those conditions of silence. Those traumatic thoughts and memories that remain unspeakable or unthinkable for too long, that is what leads to this process of that we call PTSD. It's these stuck points. So just creating an environment where people will talk and then you have to listen without interruption, without judgment.
So from all we've talked about in this interview, Shaili, what would be the take-home from this interview you'd want people to remember the most?
That trauma exposure is common. The odds are you or someone you love are going to experience a major trauma in your lifetime. So that's common. Vast majority of people will be fine, but a substantial minority will develop PTSD, and PTSD is very treatable and very manageable. And early intervention makes all the difference.
Well, it was fantastic talking with you today, Shaili.
Thanks so much for having me. I really appreciate it.
My guest today was Dr. Shaili Jain MD from Stanford University, California. If you liked this episode, check out the Wellbeing podcast for more. And tune in next week where we start speaking with a range of first responders who have experienced PTSD. Thank you for listening. I'm Jack Hodgins, and all of us at Wellbeing wish you well.